Hello, ma'am. Mm, okay, let me think about it. I recently have a difficult situation. There was a situation when the visitor were unknown about the patient's condition and what is the prognosis and what the treatment was ongoing. So the patient was quite agitated. Visitor were complaining about the care, and I listened to their concern. I asked about their problems, about their behaving like that, and they told me that they didn't know about the treatment prognosis of the patient, and I listened to their problems and I apologizing for not letting them know about the client's progress, about the treatment plan ongoing. So I educated them about the present condition of the patient, about the treatment ongoing, about the prognosis of the diseases, and I to further explanation, I consulted with my doctors, and doctor came for counseling and provided educated my patients and visitors, and that is how I handled that situation, ma'am. Yes, ma'am. There was a condition. I work in a medical and surgical ward, and the patient went to toilet and was unattended by visitors, and he didn't make any call. So he went to toilet and he fell in toilet, and there was a noise there, and we immediately rushed to the toilet and brought the patient into and checked his vital sign. There was no pulse, patient was not breathing, and we started CPR immediately. Called the healthcare provider, and we started CPR and managed every equipment needed. We called anesthesia for intubation, and yeah, that was a condition where emergency treatment was needed, and we did it. We performed CPR, and the pulse started. There was pulse, and we intubated patient in the ward, and we transferred the patient in ICU, ma'am. No, the patient is. This was currently happened like 1 week before. Now the patient is in ICU. Yeah, yeah, yeah. Okay. I generally get to my work early, and I take my handovers, and I make a list of the to-do list in that day, and I prioritize my work. Which care should be needed the most priority, I'll do that first, and I will delegate the work to my co-workers to so that every patient get their care. Yeah, that is how I manage my workload. Okay. The main most stressful aspect of my job. uh, the most stressful aspect of my job is when we see patient, we are providing the best medical treatment, but still the patient is not progressing well, and we see the patient is deteriorating, and we could not do anything. We feel helpless because though we are providing the best medical care, the patient is not progressing good. So yeah, that is the most stressful thing, I think, this in this job. um, yeah we listen to the concern of the patients, of the visitors. We explain that we are doing the best treatment. If you want to refer to certain best medical centers, then you can go as well, and yeah we provide as necessary information to them as possible. And we ask if there is anything they want to do in that period of time. We like facilitate them for for their healthcare. Yeah. mm, uh, as a team, we are doctors, nurses, physiotherapists, specialized doctors as well. So I think we nurse are the gap between patients and doctors, and we bridge that gap. We advocate the patient. We are with the patient 24 hours, and we communicate the problems of the patient to doctors, physiotherapists, consultants about the patient, and we also counsel the patient about the treatment ongoing, about their prognosis, about their we listen to their concern, and as a team, we are, I think we are we bridge the gap between patients and other health facilitators. Head to toe assessment. Firstly, we collect the vitals. Okay, first we will collect all the equipment required for the head to toe assessment. Then we will explain the procedure to the patient, and we will ask them to empty the bowel or bladder if needed, and we will monitor the vital sign, and then we will start the procedure after hand washing, and we will check from head to toe. First we will go through the hair, scalp, and we will check if there is any injuries there, if the hair density is even, if there was any previous surgery conducted in the head, if there is any this is like scalp problems, and then we will go to the face, and face we will first monitor the eyebrows. If there is in the same line, then eyes we will look for their vision, if there is any redness in the eyes, if there is any secretion present, and we will look for the peripheral vision. We use Snellen chart to look for the acuity of the vision. We will look at the accommodation of the eye, if accommodation good or not, and then we move towards nose. We will look for the smell, if the patient can smell, if there is any deviated nasal septum, if there is any secretions, if the nasal hair is present or not, and if there is any discharge present. Then we will go to ears. We will look for hearing test. We will use hearing test, conduction test, sensorineural test. Then we will move towards the mouth. Mouth we will check through, and if there is any deviation of the mouth which is present in stroke, and we will check for the oral cavity, if there is any infection present in the tongue, if there is any injuries present in the oral cavities, if there is tonsillitis present, if there is any inflammation of the tonsils, and we will look for, we will, if possible, we will give them, if the patient has, we will give something to eat if the patient has good taste sensation or not, and we will see if there is any cavities in the teeth present. Then we will go to the neck area. We will look for the trachea, if there is a central position of the trachea, if there is any swelling, if in the lymph node presence, that cervical lymph node, other lymph node present in the ear areas, and if there is, we will palpate the thyroid gland. If there is any like swelling, like hypothyroidism, there is generally swelling of the thyroid, and we will look for that. And then we will move on to our chest areas. And chest we will look at the first we will inspect, and in inspections we will look at the symmetry of the chest, anterior posterior diameter, and lateral transverse diameter of the chest, and we will look at how in the inflammation and how movement of the chest, if there is a symmetrical movement of the chest or not. If there is any redness, swelling in the chest areas, we will look for that. Then we will auscultate, inspect, palpate. We will palpate for any lumps in the chest areas. Then palpate, we will look for that vibration sound, that 99 vibration sound in chest areas, and we will palpate for the heart sounds as well, in the apical region of the chest, apical region for the heart sound, and then we will go to auscultation. So we will auscultate for bronchial sound, bronchovesicular sound, vesicular sounds, for if there is any bronchitis, wheezes, stridors. Now we will look for that. Then if female or male too, we will look for the we will look for if there is any like breast examination we do in palpation. We will look for any lumps or not, and if there is any secretion in the nipple areas, we will look for that too. And inspection, palpation, percussion, and auscultation. I forgot about the percussion. We will percuss for like chest, and there will be tympanic. I think tympanic sound. Not tympanic. Yeah, we will auscultate. We will percuss the lungs, and then we will move on to the abdominal areas. Abdominal areas. In abdomen we will inspect, then auscultate, then palpate, and then we will percuss the abdominal areas, and we will inspect all the 4 quadrants of the abdomen for any hepatomegaly, splenomegaly, any pain in the abdominal areas. We will look for the pain. We will auscultate for the bowel sound. If there is ascites, the sound will be different. Then we will go to the inguinal regions. Inguinal region for in a male, we will look for prostatomegaly, and the uniformity of the testes, and the secretion from, if any secretion from the penis areas, if there is any nodes in the penis areas, and in vagina we will look for any abnormal secretions, and for any nodes, lymph nodes, and then we will look for the extremities, the color of the extremities, the type of nails present. In anemia, there is different kind of clogging of nails is present. We will look to the nails. We will look for the capillary refill of the nails, for looking for the peripheral circulations, and we will look for the symmetry of the legs and hands, if there is any different thrombosis present, and we will look for the mobility of the limbs, if there is any abnormal movement present. And we also look for the length of the limbs, if any asymmetry of the limbs is present or not. Did I miss anything? And we also check the heart too, for the sound. We look in the second. Tell me. Definitely, ma'am. We have the photosensitivity patients who have rashes in the skin when there was exposure of sunlight. Yeah, we have those patients. We have patients with allergies having rashes in the body due to allergy of medicines. Yeah, those two kinds of. I found those two kind of patient in your search unit. uh, we both document the when I was working in ICUs, I have documented in electronic medium, but right now we are not documenting, we are doing paper system, but I'm quite eager to learn to document through electronic media too. I have once or twice documented in electronic media, but not right now. We generally record the investigation in electronic media, that record, but not the whole patient history and patient's complaint, medicine. We don't record right now in electronic media. Yeah. 30. Okay, my current facilities has 700 beds, but my ward has 30 beds, ma'am. In 30 patients, we have 2 nurses. That means we have 15:2 patient to nurse ratio. 15:2. Like, yeah. Yeah, 2 nurses in 30 for 30 patients. Yeah. No, we have helpers, attendants. Okay, one attendants in one shift, ma'am. I am working in a government hospital, so yeah. Okay. If you have gone through my CV, you have known that I have more than 3.5 years experience in this nursing field. I am very good communicator and team player, but I can be a team manager when needed. Yeah, I have worked in an ICU, SDU, which is a step down of ICU, and in a med surgical unit too. So I think I can handle the emergency situations quite well because I have both skill from various field of nurse and yeah, I'm very compassionate and I'm very empathetic nurse, which will certainly contribute to your hospital in future. Yeah, definitely, ma'am. I want to know about. Yeah, first question I want to ask is how was my performance? Thank you. This was my first interview, and I'm quite nervous about this. So, okay. Can you tell me about the area around the hospital? Yes. Thank you. Thank you to you too. Bye. Bye.